Welcome back to my YouTube channel, Health Matters with Dr. Shritama Banerjee. Today, I'm back again with another new topic. This time, I shall be talking about acid reflux. How to treat acid reflux without taking medicines. So, as you know, acid reflux is a very common problem. And if you want to stay fit without taking medicines, you have to follow certain lifestyle modifications. So I shall be listing these lifestyle modifications. Firstly, you have to take frequent small meals. Why? Because if you take large meals, then large meals will exert greater pressure on your abdominal wall. Also, they will exert greater pressure on your gastroesophageal junction, which separates the stomach from the esophagus. And you know that when the gastroesophageal sphincter has greater pressure on it, then there is more chance of acid splashing back from the stomach to the esophagus, which is acid reflux. So you have to take small meals, frequent meals to avoid acid reflux. Coming to the second point, you have to stay up after eating. That is, you have to stay up, that is, you have to either sit or you have to stand for some time or you have to keep walking. That is, you have to keep your body erect after taking your meals for at least around 3 hours. So you should not go to bed before 3 hours after taking meals. Why? Because if you are in the erect position, the gravity normally will help in the food coming down from the esophagus to the stomach and outside through the intestine and all. So, if you go to sleep immediately, then the gravity will not be able to help you in pushing the food down from the esophagus to the stomach. And then there's more chance of acid reflux. So, you have to maintain a gap of at least 3 hours between your meals and going to sleep. Coming to the third point, you have to avoid spicy and fatty foods. Why? Because spicy foods irritate the esophageal lining and the gastric lining of the the stomach and the esophagus and lead to damage of the mucosa. Also, fatty foods relax the lower esophageal sphincter, which separates the stomach and the esophagus. So, if the lower esophageal sphincter is damaged, then and if it is relaxed, then there's more chance of acid reflux. So you should avoid spicy and fatty foods. Coming to the fourth point, you have to sleep with your head end raised around 6 to 8 inches than your feet end. Why? Because in this way, the gravity will be able to help to take the food down from the esophagus to the stomach and then downwards. So you should allow the gravity to help you. So you have to sleep with your head end raised by around 6 to 8 inches from your feet end. Coming to the next point, you have to lose weight. Why? Because in obese persons, there's more pressure exerted on the gastroesophageal sphincter and on the lower esophagus muscles. So that allows the acid to go back into the esophagus from the stomach. So you must lose weight to prevent that from happening. If you are a smoker, you have to quit smoking because nicotine from cigarette smoke relaxes the lower esophagus sphincter, again enhancing gastric reflux. And also, another thing happens if you are a smoker, that is, smoke damages the lower esophagus lining, the mucosal lining, and it actually decreases the protective mucus layer and leads to more damage. That is, first of all, it decreases the constriction. That is, it relaxes the lower esophageal sphincter. So there's more chance of acid reflux, and also it decreases the protective mucus layer over the esophagus. So it also increases the damage that the smoke, the cigarette smoke, or the nicotine is going to cause. So smoking leads to many types of cancers, as you know. and therefore, obviously, you have to quit smoking. Also, if you are a drinker, if you are into having alcohol, you must quit alcohol because of many reasons. Firstly, alcohol increases the secretion of acid from the stomach, and also alcohol relaxes the lower esophageal sphincter. The alcohol also relaxes the lower esophageal muscles, which are normally constricted, and they decrease the chance of acid reflux. So, if these muscles, if the sphincter, the lower esophageal sphincter, is relaxed, and also if the lower esophageal circular muscles are relaxed, then the acid is going to reflux back into the esophagus, and the refluxed acid cannot again re-enter or come back into the stomach. So, it's a very bad condition. So, you must decrease the amount of alcohol that you have, and it's better if you can totally quit alcohol. And coming to my last point, if you are a patient of GERD or gastroesophageal reflux disease or acid reflux patient, you must sleep on your left side. You must sleep turned on your left side. Why? uh, you'll understand better if I show with a picture. Is it visible? Just wait. One second. I don't think it's quite visible. Just one moment. One moment. Yes, sorry for that interruption. So, this was what I wanted to show you. So, as you can see, I have drawn two pictures in which this is where the person is sleeping turned on the left side, and this is where the person is sleeping turned on the right side. So this is the esophagus, this is the stomach, and then this is the small intestine starting. Same case, esophagus, stomach, and small intestine is going to start. So when you sleep turned on your left side, so this is the greater curvature of the stomach which is there on the left side, and this is the lesser curvature of the stomach which is there on the right side. So if you sleep turned on your left, what is going to happen is that you sleep like this. So the acid is going to come from this side, and it's going to try to go up, and it cannot. It's going to slide down the greater curvature, and it's going to come back, revert back into the stomach. And hence it's going to go down, and so acid reflux cannot happen. If you sleep turned on your left side, this is the position. Now, if you sleep turned on your right side, if you sleep like this, then the acid is going to come. It's going to try to go upwards to the esophagus, and here is the entry to the esophagus, and it's going to easily enter into the esophagus. So the acid is going to slide upwards through the lesser curvature of the stomach, and acid is going to gain entry into the esophagus very easily because the mouth, the lower esophagus sphincter, is directly on the top of the right side. So if you sleep on the right side, the acid is going to gain entry into the esophagus very easily. And if you sleep turned on your left side, then the acid is going to try to go into the esophagus, but it's going to not get entry, and it's going to slide down and revert back and slide down and come back across the greater curvature and come back into the stomach. So, if you are a patient of acid reflux or gastroesophageal reflux disease, GERD, then you must sleep turned on your left side. You have to keep this in mind. So, this brings me to the end of this video. Hope you like it. hope you will be able to derive benefit from it. Then only my mission to spread health awareness will be successful, and I shall be back again with another health video. Till then, stay healthy, stay happy, take care, and bye bye.